Can bone-on-bone hip osteoarthritis hurt all the time? The answer is usually no, it doesn't hurt all the time. In more than 9 out of 10 hip arthritis cases, there are at least moments where people don't feel any pain. The majority of people will get a flare-up of hip arthritis and feel pain for a few hours, maybe the rest of the day, or maybe one more day at most, but then they can rest, get off their feet, and typically the pain flares down and they can get back to feeling basically okay again. Maybe they still have some discomfort when they do certain things, but they can get into a comfortable position where there's no pain. Now, if the root cause of hip arthritis is not addressed in this individual, then it sets them up to begin to get more flare-ups more frequently over time, and for them to come on easier with less intense activities. The pain can be temporarily alleviated by doing things like taking pain medications, getting a pain injection, stretching, and even some exercise can help the pain calm down. But if the root problem is not addressed, which is usually a muscle imbalance, then it's likely that the hip arthritis will gradually progress over time. Faster for some that are maybe predisposed or doing certain activities that are progressing the hip arthritis, and slower for others that are maybe not as active or just aren't as predisposed to getting arthritis in their joints. But doing very specific exercise that's focused on addressing the root problem, the root cause of hip osteoarthritis, is the solution to getting the hip arthritis under control so that you can be active, healthy, and mobile without worrying that the hip arthritis is just going to progress over time, because it's not related to age, as most people in the healthcare industry will say. It's actually related to the muscle imbalance, the root cause that's putting excessive compressive forces through the hip joint. And addressing that muscle imbalance, the root cause, can take off that excessive compressive force despite your age and allow your cartilage in your hip joint to heal and begin to get normal again. There are only 2 situations where bone-on-bone hip osteoarthritis will hurt all the time. And it's not that frequent that people get to this point. Let me tell you what I mean. The first situation is when people have end-stage hip osteoarthritis. And the way this looks is people have usually been suffering at this point for years, maybe even a decade or multiple decades. They've been suffering with hip pain. And if they go to the doctor to get an x-ray, it's usually blaringly obvious that the ball and socket joint are deformed because there's been so much hip arthritis there for so long that the shape of the ball has become lumpy. The shape of the socket is no longer smooth and round on the inside. And so the joint just doesn't move normally anymore. This person will probably experience a loss of range of motion. They've probably had it for some time now, months at least, if not years. And they may be getting hip joint locking, where they're trying to move their leg and it just freezes and gets stuck. It's usually painful, and they have to wiggle it around to get it to loosen up so that they can begin to walk normally again or do whatever they're doing. And speaking of walking normally, that doesn't happen for this person. They're usually limping, they're usually in pain. They've probably been using a cane or a walker for some time now, or they should have been if they haven't already. And when they see the doctor and the doctor sees their x-ray, that surgeon is probably going to say something like, "How have you been even walking around and living with this hip?" The only solution, they're going to tell you, is to have the hip joint replaced. And I would agree in those situations. If the ball and socket is all lumpy and deformed, there's no space in there anymore, and there's a loss of motion and hip joint locking, then it is likely that you need to have a hip joint replacement so that you can begin to get your function back, so you can begin to walk normally again and do normal activities without your hip slowing you down. Now, that's the main situation where you're going to have consistent hip arthritis pain, but that's been progressing for a long time. Usually people haven't done anything about it. Now, the second situation, this is the more common one, but it still doesn't happen that frequently. It's when there's a mild to moderate hip arthritis, but it's extremely flared up. Now, what I mean by mild to moderate is if you go look at that x-ray, if you have an x-ray, the shape of the ball and socket joint still is round. It's not all lumpy everywhere. There may be decreased joint space. It may be that it's bone on bone, like the doctor might say that there's less space in the joint. They may even say that the cartilage is worn away or that it's decreased. But if this is your situation, then you're typically going to have full range of motion in your hip or near full range of motion, and you probably don't have hip joint locking just yet because the ball and socket are still round surfaces and have the potential to move normally. So this wouldn't be considered end stage hip osteoarthritis. This is just a very flared up hip joint if it's hurting severely. And if you keep doing things to aggravate it, to consistently put pressure through that hip joint that's excessive, then you're going to not let it ever calm down and heal, and so it can remain painful for weeks on end, maybe even months on end, and that's what sets you up for that constant pain. Now, I found that the most common problem when it comes to hip arthritis is that muscle imbalance where you are getting Now, I found that the root cause of hip arthritis is a muscle imbalance, where if this is the ball and socket joint of the hip, on the front of the hip you have certain muscles that are usually called the hip flexors, and on the back of the hip it's the glute muscles, the butt muscles. Those muscles are out of balance, and the ones in the front are usually too strong or too dominant, and so it's pulling the ball forward on the socket and causing those edges to rub excessively. And if you have this underlying muscle imbalance, which most people that have hip arthritis do, then every activity you go do, it's going to rub excessively. And if you overdo it somehow, like if you're on your feet longer than you usually are on a normal day, or if you are picking up something heavier than you usually pick up, then it's going to compress the ball against the front of the socket extra, because your tendency is to use those hip flexors because of the dominant or stronger muscle group. Now, some people will go do exercise in order to help their hip arthritis, but if that muscle imbalance is there, then you're going to potentially cause those hip flexors to activate extra and further irritate the hip joints. And this is why sometimes these people that have even just mild to moderate hip arthritis, but it's very flared up, will get to the point where they end up getting a hip joint replacement, because at that point they've typically tried medications, they've had pain injections, they've gone through physical therapy and had exercises to try to help the hip arthritis. Maybe they've tried cycling and walking and other things, but it still hurts, and they're desperate because it's been going on for weeks or months, and the surgeon, doing the best they can with what they know, will say, well, you tried everything, so let's go ahead and do the hip joint replacement. And sadly, I've seen so many patients for other problems, because I've seen them after they've had their hip replacement, the root problem wasn't addressed, and that root problem can cause other problems. They carry it with them into the surgery and after the surgery, and it eventually begins to cause knee pain or back pain, or the other hip becomes involved, or sometimes even the same hip that they got replaced still hurts because there's other things there, other muscles, tendons, ligaments, nerves that can also become affected from this muscle imbalance, and so they'll continue to have hip pain in the same hip that they got replaced. So when I see these patients after they've had their hip replacement, they'll sometimes share with me that, you know what, I didn't have any pain for about a week before the surgery, and I started to second guess if I should even go through with the surgery. But they end up going through the surgery because they remember how bad they suffered for so long, and they don't want to go through that again. And plus, they're already scheduled. They don't want to let the doctor down. There's all these other factors that lead them to going through with the hip replacement surgery. But the fact is that they never saw a specialist that could help them resolve the hip arthritis naturally without surgery. And they don't know that because they, like going to physical therapy, for example, they thought maybe that's where it was going to happen. But most physical therapists are specialists at helping people after surgery. So they're great at helping people after a hip replacement surgery, for instance. But when faced with having to help somebody avoid a hip replacement surgery, they typically default to doing the same exercises that they would give somebody who's had a surgery, and that's not what's supposed to be done. You need specific exercises to address the root problem of hip osteoarthritis to make sure that you can avoid a hip replacement surgery. I've put my treatment approach that I take people with hip arthritis through to help them avoid surgery into a program that I've made available to you. It's called the Hip Arthritis Recovery Program. This program is comprehensive. It's designed to help everyone from someone who's just starting out with hip pain and has mild hip arthritis, all the way to somebody who's more severe and is maybe having constant pain and probably can't walk and having other issues related to their hip arthritis. It's been going on for years. We can help them, even if it's been bone on bone for some time. This program is designed to decompress that hip joint by addressing the root muscle imbalance. It's a whole process that you have to go through, and it can't just be fixed with one or two exercises over a short time. It truly is a comprehensive process. So you can learn more about this program through the link down in the description below. And I've also got tons of other videos for hip arthritis to help you here on YouTube. I put them in a playlist for you. It's called the Hip Arthritis Help Playlist. You'll find a link for that in the description too. Hey, thanks for watching this video. Please give us a thumbs up if you thought it was helpful for you, and please share this with somebody you think needs to see this so that it might help them. And don't forget to subscribe and hit the notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Drop a comment, please. We'd love to hear what you have to say. Let us know if you have any questions. We'd love to get back to our comments as fast as possible. Have a wonderful day. Bye-bye.